Next, Kathrine Barieas.
Good afternoon. My name is Dr. Kathrine Barieas, and I'm Director of Child Welfare Policy at One Voice Texas. I have extensive experience in the areas of privatization and prevention in particular. Thank you for the opportunity to testify today and to the Sunset staff for their really hard work. The first issue area I want to bring to your attention is redesign. One Voice Texas is in full support of the recommendation that redesign not move forward until DFPS has conducted a thorough evaluation of current problems and established a clear plan for future implementation efforts. In particular, the focus should be on the financial burden to the single source continuum contractor, such as the serious deficit that Providence Service Corporation currently faces. Second, a lack of a process evaluation which allows us to understand why we see the outcomes we see. And third, a plan to address needed changes within the current legacy system, as research has shown us that privatization efforts are only as strong as the state agency which implements and monitors them. The second area I would like to highlight is the recommendation to transfer prevention programs from HHSC and DSHS to PEI. We strongly disagree with this recommendation. As Ashley pointed out, Sunset staff clearly indicate in their report that PEI has been chronically underfunded without strategic direction and lacking clear outcomes by which impact can be measured. The report states that DFPS has not yet demonstrated the level of commitment needed. History also supports this fact, as DFPS has consistently placed prevention at the bottom of their exceptional item list. Therefore, at this time, it does not appear prudent to add to the responsibilities of PEI when there are actually numerous current statutory responsibilities which they have been unable to meet. At a minimum, the legislature should certainly support the strategic planning and outcome development recommendations contained in the report. However, this commission has an opportunity to structure prevention at the state level so that efficient and effective coordination, which were highlighted as important goals by the 1998 Sunset Commission and the creation of the HHSC enterprise, can be realized. Given that more than once the Sunset report highlights that child maltreatment is a symptom of larger social issues, it's necessary to recognize that prevention and early intervention efforts are not clearly the responsibility of PEI, but rather span several state agencies that deal with mental health, substance abuse, domestic violence, and health care. Therefore, One Voice Texas recommends that the Sunset Commission consider restructuring prevention at the state level so it is an agency under HHSC rather than one contract division under PEI or directly under the DFPS Commissioner. And in my written testimony, I outline a model for you to consider. Thank you for your time. I'm happy to answer any questions you might have, and as Ashley said, we can certainly meet with your office because we have several recommendations around the internal complaint process.
Thank you, Doctor. Members, any questions? Okay.